The more contagious variant of COVID-19 that was first identified in the UK has now been discovered at a number of long-term care homes in Ontario. In some cases, it has resulted in explosive outbreaks and dozens of deaths. Advocates are calling on the Ford government to call in the military to help hard-hit homes and to speed up the rollout of the vaccine before more seniors are killed.
There is an active refusal to acknowledge how bad things are.
And in some homes, the situation is only becoming more dire, like at Roberta Place in Barrie, just north of Toronto, where all but 2 residents have been infected with COVID-19 and 40 people have died. The UK variant has been identified as the source of cases at the home, and advocates say vaccines are arriving too late.
Roberta Place is a key example. I mean, the vaccines got to the home when the home was already engulfed in the outbreaks.
The province aims to vaccinate all long-term care home residents by February 15th. But if the target was January 31st, a government advisory group has projected potentially 600 infections and 115 deaths could be prevented.
That's going to save 100 lives. That's 100 people, 100 families. Premier, we need to get all these vaccinations done by the end of the month.
The Ministry of Health tells us delayed Pfizer shipments are impacting the province's vaccine rollout, and they are vaccinating long-term care residents as quickly as they receive vaccines from the federal government. For some families, it is already too late.
We received a call from the home saying that she wasn't going to make it through the night.
Jennifer Penny's 81-year-old mother passed away December 26th, just days after a COVID-19 outbreak had been declared at her Niagara Falls long-term care home. When Penny arrived at Oakwood Park Lodge to say goodbye, she was struck by the lack of staff available to help residents.
There was nobody around. It was like a ghost town.
As she was leaving, one resident in a wheelchair was calling out for water, but there was no one around to help.
We weren't able to grieve the loss of my mom. We were more focused on the residents that were left behind. We knew that there wasn't enough staff to care for them and that there was neglect and suffering going on.
Staffing issues remain a significant problem, and advocates can't understand why the Ford government has refused to call in the troops.
Why are we turning away help that could provide stabilization to some of the worst hit homes? We have reports from the homes themselves that are saying that they are wildly understaffed, so bad that it is apocalyptic in some homes.
Staff also vulnerable to the virus. A 19-year-old Yazdani, who worked as a cleaner at a long-term care home near London, Ontario, died Thursday. The region's associate medical officer of health says he likely contracted the virus while working at the home.
The unexpected death of someone this young, recently diagnosed with COVID, of course, is so tragic. We've had a number of outbreaks, some of them fairly large, within the last month to 6 weeks, and certainly those are a heavy concern for us.
Dabe is the 11th long-term care worker to die of COVID-19 in the province. We did reach out to the Ministry of Long-Term Care today and asked specifically why they aren't calling on the Canadian Armed Forces for help. They didn't answer that question specifically, but they did tell us in a statement the situation at Roberta Place underscores the need for everyone to stay home to stop the spread of COVID-19 and help protect long-term care homes, especially as we find more evidence of new variants in our communities. It is also a stark reminder of the need for greater vigilance at our borders with incoming travelers. They also tell us the Canadian Red Cross has been deployed to help Roberta Place. For City News, I'm Tina Yazdani.